Gentlemen, when PAD has progressed, and we touched upon this just a little bit, beyond the early stages, shall we say, it means there's obviously a very serious problem and with the blood flow to the legs. Is that why actually I was thinking of my early days of pre-med, when you go to the doctor, I mean, not lift my leg too much, but they put their hands there and they start feeling and they hear everything?
Right, so what you're doing there is feeling a pulse.
Exactly.
You're trying to feel an area where the artery may be somewhat superficial and trying to see if you can actually feel the blood supply, the arterial blood supply, getting down to the feet. So that may be one of the easiest ways where at a physical exam, they start looking and assessing you for peripheral arterial disease.
I figured some people out there would realize, oh, I know exactly what she's talking about, right?
And that's exactly right. And when you have narrowing, at some point that pulse at first becomes diminished or harder to feel, and then ultimately you can't feel it at all. And then that's when that ankle brachial index, or what we're talking about earlier, is that test is decreased, and that's a sign that you've got blockages in your legs. You just can't feel that pulse as well.
And that serious blood flow then can possibly sometimes lead to a high risk for an amputation. Is that correct, gentlemen?
Absolutely, yes.
And that's because obviously we're getting to the point of...
Yeah, well, once you get to the point that you have what we call critical limb ischemia, you just don't have enough blood flow going down to the foot. It's typically an unfortunate story. You could have a diabetic patient who has poor feeling as well. They have something called diabetic neuropathy where they can't feel. So they get an injury to their foot. They don't feel it at first. A little wound develops, and once a wound develops, you actually need more blood flow to heal it than if the skin is intact. And when you have those blockages in your arteries, you just can't heal. There's not enough oxygen going there, and that starts that cascade. The wound gets bigger and bigger, and if something isn't done, that could lead to an amputation.